All right, so we're back here, Dr. Ross, and we're going to talk about like what can I do as an individual and what does that look like. So you had mentioned before the main stuff that helps with cardiovascular health, that helps with diabetes, which is, we're talking about exercise, physical activity, and then some of the dietary components there within, right?
Absolutely. Yep.
Okay, so this is where we start to get a little bit more into our world, right? But when we talk about exercise and physical activity, I think there's general then specific when we mention these types of things. So most of these physical guidelines are to not be sick, right? To not be ill. They're not to be optimized. One of the things that we focus on here is how to optimize or be the best version of that. And I think we run into some of that problem also with some of the medical system, because a lot of their tests or their definitions are you're healthy means you're not sick, right? But there could be a better version of that, right? And so, we talk about, walking briskly, cycling, dancing, various other physical activities. When we talk about how these things benefit anxiety, fatigue, so this is not necessarily directly related to prostate health, even though it does help. Improving self-esteem, feelings of optimism, improving heart health, maintaining healthy weight, boosting muscle strength and endurance. So, there's also things in our realm, though, that could be more specific. We can coach through some of these, but we also refer out to some very highly skilled pelvic floor PTs, and they will go over some pelvic floor anatomy, exercises, manual releases that can benefit and help some of the symptomology and other components of that. But when we talk about activity, one of the things is just because you check the box, right? It's like the library. I always like to use the library, right? Like I went to the library and I sat there. I didn't read anything, but I was in the environment, and then I left. Like, how much smarter did I actually get, right? Not very. And so the difference is kind of like checking the box and what I refer to as filling it in, right? Making sure all the corners are there. And that comes with like intensity, intention, consistency and persistency that you had mentioned earlier, and making sure that when we talk about the physical activity, and one of the things that we do here is you may love walking and running, but then sometimes it fights back because maybe there was some issue with your body or your body didn't like it. But now, because you found the one thing that you did like doesn't work, now we do nothing sometimes, which is a bigger problem, and that can extrapolate things over longer periods of time. And so we want to make sure that, one of the things that we focus on here is making sure that you have the parts and pieces to do the things you want to do, and if not, to find the thing that you can do. Those are the biggest things that we focus on here. Some other components that we want to talk about, and we'll have several different websites up here, and we'll put a lot of these in the links and stuff, and these were all provided by Dr. Ross. But we're going to see some very common themes here. When we look at what kind of work, when we talk about tomatoes and turmeric, when we talk about things that are problematic, too much red meat, too much processed meats, too much dairy. Dairy is a very interesting thing because we are the only mammal that drinks another mammal's milk. So first off, strange. The other component that's interesting is we're the only mammal that drinks that drinks milk outside of birthing years. So these are all constructs that we've kind of created for ourselves. And so you're going to see a lot of the cardiovascular disease and of people with cancers and of people that have any health issues. They're going to say try and stay away. They can be pro-inflammatory, and there's a lot of like allergies and it's some enzyme deficiencies and some other things that go along with that. But when we talk about themes, right? So we're going to go here. All right, so this is UCSF guidelines. Mostly plant-based, lots of fruits and veggies, high fiber, low fat, less sugar. It's not sexy. This is not a very fancy, creative thing here, but it's effective. Now, one of the things we also want to talk about is making sure that the foods are right for you as an individual. So these are generally, and this is the general versus specific, these are generally work, but for individuals like my son, who cannot have eggs and dairy, eggs you'll see are going to be listed on there, something that you should try and pay attention to. And then for my son, it would kind of kill him. So we want to make sure that these are things that there are tests, and we have, you know, naturopathic medicine doctors and other people that we refer to that will do tests to make sure that you're eating the right foods for you, not just right foods that generally help a cause or something along those lines. And listening to our body and understanding what those look like. And then when we look at Harvard here, right, talking about what can we do, fruits and veggies, whole grains, that's all relative, right, to people who can tolerate those. When we limit consumption of these animal proteins and then eating more healthy fats. So the big thing that you're seeing across all research basis here is a flexitarian diet will probably win. So you're going to have some meals that probably will not have animal protein in them. But we'll have other meals that do, right? Because there's issues there if we don't have enough animal protein also. Low sugar, for sure. Managed sodium, depending on activity, because we also have very active individuals. So active individuals would need more sodium. This is when sodium wins, and not having sodium would lose. So circumstance. Portion sizes, I think we all, in like chewing food and eating slowly, are all healthy behaviors that we can take in this fast-paced society. It's like, how fast can I do everything? How many things can I do at one time? So just kind of being a little bit more mindful with that process. And then when we're talking about healthy fats, which is a big one, right? Not having saturated fats. So a lot of the ones that they'll talk about is that if it has eyes, ears, wiggles, waggles, if you have to chase it, right, before you can eat it, you probably want to limit the amount of consumption there. And so, you know, having fruits and veggies that work for your body and understanding that, looking into things like following a FODMAP diet, a flexitarian with more fish, more veggies are all going to be indicative of that. So these are things that we can kind of coach you through and kind of shed a little bit of information on as part of a treatment team or as part of a team of people that can help you be healthy in the behaviors that you have and that you instill. We also have experts that we refer to that can kind of do more checks and balances, more detailed work along those lines. Now, if we wanted to find out more information about you, the work that you do, can you explain some of that to us, please?
Sure. Well, I'm a radiologist. I work in a group called Imaging Healthcare in San Diego. We have a website with a fair amount of information on what we call the Men's Health Program. That's will be information on the MRI and the biopsy we do, and some experience with other patients that have come through. And I also have a website called the prostatemriguy.com where I talk about these crazy things. And yeah, it's the key, I think, with what, in my experience in medicine, lines up with what you're saying. Be intentional. Find a program that works for your situation. Engage in that. Don't just go with the flow because that's what everybody else is doing. That might work for you, but it might not. So put in the effort up front. Take the time. When we're talking about prostate cancer, first thing I tell the guys when they get a diagnosis is don't feel panicked. You have time to educate yourself. You have time to figure out and navigate through what the natural history of the disease is going to be, what your treatment options are. And I would say you should apply that to any time you're engaging with the health system, because you do have to look out for yourself. It's wild, wild west out there, and you want to be your own best advocate.
Absolutely. Really appreciate the time today, Doctor. Sure. And we'll have you back at the end of the month here to kind of go over some questions. But enjoy, guys, and hopefully we can be helpful.